It's a common misconception that we're doctors of the joints, but actually what we work with is your neurological structure to keep the body in balance and in good function.
When somebody comes for a chiropractic care,
Yes.
I have seen a lot of videos online where they're like that, they're like cracking every single joint, like within one session. And when I came to you before, and you're like, yeah, this is not how you're supposed to do it. What is the difference between how you do it and how you see things on internet that every joint you're cracking?
But when you take a rest, let's say using the example of a broken bone, muscles atrophy because they're not being used. The body is intelligent. The body will allocate resources where you put your energy and movements in. So muscles atrophy when they're not used, the same way that your brain will wither if you don't learn, things like that, right? So everything has a sequence of appropriate timing.
I'm a trainer bana hu. The amount of time that I've heard this, कि I have to sweat to lose weight, is like, I don't know, every now and then we used to listen to this, and abhi to it's gone down quite a bit. Nobody says this now, but still somewhere these concepts are there. Okay, they like to work out in a very warm temperature because they want to sweat, because they think sweat makes them lose weight.
I mean, the concept of neuroplasticity is that you can learn anything at any time. It takes longer when you're older because the existing neurological connections are so strong that sometimes pathways around them or through them can be a bit harder to find. So it's that idea of teaching an old dog new tricks. It is possible, but it takes longer when you're older. When you're younger, it can be a faster process. The body is generally more optimized and more efficient the younger that you are.
So आज हमारे साथ हैं डॉक्टर महानास, chiropractor. Hello Mahnaz, how are you doing?
Hi Pervez, nice to see you.
Nice to see you. मैं काफ़ी टाइम से actually I wanted to call you on the podcast because एक तो chiropractic care होती क्या है, not many people know about it. Normally हम लोग को लगता है कि सिर्फ joints को crack करना chiropractor का काम है, but once I spoke to you, I understand there's a lot to do with the nervous system, right? So in a very layman language, can you explain what is chiropractic care?
So chiropractic is a primary healthcare approach that we use to assess the body through your neurology. The reason is because the neurology of your body controls everything in the body. Every sensory experience that we receive, any motor experience that we output, organ function, system regulation, heart rate, breathing, all of this stuff is modulated by your nervous system. So because the adjustment is focused around structural components as well as neurological touch points and reflex components, it's a common misconception that we're doctors of the joints, but actually what we work with is your neurological structure to keep the body in balance and in good function. So the reason that the joints come into play is because elements of your nervous system live inside your joints. So your spinal column contains your spinal cord, and each segment of the cord controls a different part of the body. You can imagine if there's some kind of pressure buildup or interference or misalignment that changes that particular segment's ability to communicate with the body, the output of that body or the input from that part of the body will also begin to change. So when you centralize this across the entire body, top to bottom, you can actually start to see patterns of dysfunction that people experience, whether it's systemic, meaning digestive, heart, breathing, endocrine, immunity, things like that, or functional, structural, so joints, muscles, bones, tissues, ligaments, things like that.
So it's really sound like a chiropractic introductory class.
But it's important to educate because
but
people
at the
do.
same time, it is also because a lot of people maybe who's listening, they do not understand and speak the language of science properly. So I really want to narrow it down to the as basic language as possible.
Understood.
क्योंकि not a lot of people understand the structural and neurological things that we speak about. So how can you explain it to someone like this guy who's sitting behind the camera? How do you explain this to this person?
So if we were to break it down into a very simple language, if we say that your nervous system is the electrical wires
That's
in your
your
house.
brain.
Yeah, so
That's
your
your
brain and your spinal cord. These are the central breakers that you have inside your electricity board in your house. If a breaker is damaged or broken, the entire circuit of that breaker is going to short. Your lights will keep going off, your ACs will keep tripping, things like that. Now you have two options. You can either keep resetting the breaker. Eventually the breaker will wear down to a point where it will need to be replaced. The chiropractic approach that comes in with that analogy is that the circuit breakers are your different spinal segments. If you're experiencing problems in one part of the body, yes, absolutely, you can localize, look at that part of the body. Is that part of the body okay? But if you start to look at long-term healing, you start to look at overreaching improvements, you need to come back to the source. And the source is always going to be those spinal segments in your nervous system. Does that make it a bit easier to understand?
Yeah, and understood. So when somebody comes for a chiropractic care,
Yes.
I have seen a lot of videos online where they're like cracking every single joint, like within one session. And when I came to you before, and you're like, yeah, this is not how you're supposed to do it. What is the difference between how you do it and how you see things on internet that every joint you're cracking? What's the difference?
So when we talk about the crack, what you're in essence talking about is putting force into someone's body to create a
Okay.
change. ठीक है? The body is sensitive. It picks up information from your environment. It picks up input from your daily life on a very, very small level and on a very large level. Whenever we put input into the body, we are using that force to change the body state. So there is, you've heard of this expression, less is more, right?
Yeah.
The less that you do, the more the body is able to concentrate and focus on the change in that one particular area. If you give anybody too much information in one go, system overload ho jata hai. People can't understand, the system can't process that input. So in essence, what happens when you adjust too much is the body doesn't actually take on any great effect from any change because it's kind of created more chaos than it's created stability. So an adjustment, a chiropractic session is specific. It is targeting very specifically analyzed areas that are considered to be primary according to our protocols. And the specificity is what gets you the better outcome.
Okay. So there's one thing that I understand about the body is, and about the therapy and about the chiropractic care and about when you put in the fitness together and all those things, exercises and all. What I realize, correct me if I'm wrong, what I realize is when you go for chiropractic care or even when you go for therapy, after that you have to train and make those areas stronger, what you just adjusted or you're recovering from. Because if you don't do it, it started to go back on the same place it was.
Yes.
This is what I realized because of my own injuries and because what I understand, what I read and what I try to understand. Because I don't try to read and understand things from one perspective only, because my perspective will only come from the exercises that I do, right? But I have to also understand the perspective of a therapist as well. I have to understand the perspective of chiropractic care as well. So there are different perspective. There's a different information you're giving to your body. And I think that it's a combination of all three things that helps your body to recover better.
Absolutely. Yeah.
Yeah. But what I see around, you go to a chiropractor, they're like, do not train. You go to a therapist or a doctor or any doctor even you go to, they're like, do not do squats, do not do lunges, do not climb stairs, do not sit on the floor. These kind of things doctors are saying. And it's always been my question, like, how can I recover if I don't do those stuff? What's your take on this?
I think everything comes in at the right time. I think it's important to make a distinction between structures of the body and functions of the body. So if we have a structural concern, let's say, for example, a bone is broken, absolutely that bone needs time to heal, in which case the advice would be rest, take a load off, let it, give it time to heal. But when you take a rest, let's say using the example of a broken bone, muscles atrophy because they're not being used. The body is intelligent. The body will allocate resources where you put your energy and movements in. So muscles atrophy when they're not used, the same way that your brain will wither if you don't learn, things like that, right? So everything has a sequence of appropriate timing. Now, a lot of the times when medical practitioners in this country give advice, they are usually speaking from their own limitations. So if a physician, a doctor, doesn't have any therapists or any collaborators to work with in order to help a patient get back to movement, the easiest outcome for that doctor will be to say, don't do it, because they themselves lack the tools to help the patient come back to a place of stability, recovery, and functionality, right? So what we say with that is that if a joint is damaged or if you have injury in the body, rest is the same as between workouts, extremely important. You need to give the body time to recover. But then you adapt your training plan, you are flexible with it, and you introduce different movements, different kinds of exercises that can work on surrounding structures, secondary structures, supported structures, to create the beginnings of a comeback to activity. Now, if a person has not done a squat for 10 years and they walk into a gym and they squat 40 kilos on their first rep, there is going to be disc pressure. There is going to be muscles that will complain. You may strain something. You may pull something. If the chemistries of your body are not balanced, your vitamin D levels are low, your magnesium levels are low, and you've confirmed them with blood tests, for example, then yes, you are putting your body into a state of risk, in which case injury is likely. However, if that person then comes back and says, the squat is important to me, I want to be able to do it, it's a very basic functional movement, what you can work on is supplementing that squat exercise with other activities in the beginning. Let's work on quad strength, let's work on hamstring strength, let's work on getting the body chemistry balanced, improve your vitamin D, improve your zinc, your magnesium, your calcium, right? Improve your diet. When you've created the precursor state for the body to achieve that squat, you build it up and then your squats are achieved. But to say don't do it is basically to resign yourself to a static state of the body with the assumption that the body doesn't learn and it doesn't change. And that is just not the case.
Yeah. Uh, Everything you just said, that you are also coming from a fitness background because you train regularly for many, many years, and you're a doctor as well. So you understand these things. Now you tell me something, in a medical practice, are the doctor taught the exercises?
So my knowledge will always be limited to my own profession, which is chiropractic. However, anatomy doesn't change profession to profession. We all learn the same anatomy. We all learn the same muscles. We learn the same joints, the same bones, and the same basic elements of neurology, digestive system, cardiac system, respiratory system. The depth to which each of these areas is studied is then definitive of your specialty, right? So if you ask me detailed questions about digestion, right, I'm not a gastroenterologist. I wouldn't be able to say, but I am a specialist of the nervous system. I may not be a specialist in neurosurgery or in neurological dysfunction, so neurological conditions like tremors or things like that, but I do understand functionally how the nervous system operates with regards to the body. So there are elements of limitations of knowledge that we have depending on the specialty each person chooses to go into as a professional. I think overarchingly, anatomy is taught without the functionalities of anatomy. So you can understand what is the bicep, long head, short head, but you may not necessarily understand to what degree of motion is the short head, to what degree of motion is the long head, to what element of rotation the bicep is involved in, where do the rotator cuff muscles come into play, at what point. That kind of detail is maybe more somebody like yourself, somebody who works with muscles on a daily basis, or a physiotherapist, right? So there are limitations. I think the important thing is everyone should recognize their limitations. I've always believed that collaboration is more powerful than competition. I think that if we bring in specialists from all different fields and we pool the knowledge together as a shared resource, इसमें सिर्फ बेहतरी निकल आ सकती है, because then we're all working together for a common cause. And the common cause can be to change a mindset. The common cause can be to help one person get back to squats.
Yeah, yeah. But tell me something. I just want to understand a little bit about nervous system. So over the years of being into a fitness industry, one thing I realize about the aging, that whatever functionality you're not using it on your daily basis, your nervous system started to lose it.
Yes.
Yeah, this is a part of aging, because I've seen a lot of older people around me. They're unable to do basic daily activity.
Yes.
Yeah, and one of the major cause of it is because they do not exercise, and they stop doing certain things maybe they were doing 10 years ago.
Yes.
And in my own mom's case, it is her back injury, and after that doctor asked her not to go sit on the floor, not to climb the stairs, not to pick anything from the floor. These are the 3 restrictions doctor put on my mom, and that was 30 years ago.
Right.
Now I understand the medical practice and understanding of muscle is different right now than 30 years ago. But even right now, I don't see much has changed from the doctors. What do you think?
I mean, there is an element of, again, limitations that everyone works within their scope of training. I think that in an ideal situation, what you'd want to say is that a doctor is recognizing a patient is struggling with certain movements, and they might refer the patient then to a collaboration center to say, I can't help with getting you back to sitting on the floor, picking up things from the ground, but maybe if you were to take some time and put some energy into this direction, right, your body would benefit. So what you're talking about a little bit is something called neuroplasticity. Neuroplasticity is the body and the brain's ability to learn and to continuously learn. That's how there's no point at which learning is impossible. It gets harder the more those neurological pathways become, let's say, cemented or fixed. Habits, for example, is an example of this. If you have a habit of doing something every day and somebody says don't do it, to break that habit is difficult, but it is possible. So when it comes to giving advice about what to do and not to do, I think it's always important to remember two components: structure and function. If the structures of your body, osteoporosis, a damaged disc, a torn meniscus, a blown ligament, right? A shredded muscle, an organ failing. If the structures of your body are creating limitations, your functions must adapt to the structure. And adaptability is actually one of the key concepts we work with in chiropractic, because your body is constantly receiving information from the environment, right? Your body then responds to the environment. Iska agar hum ek example le lein to sweat is an example, right? The sensory system in the body receives information that the temperature in your ambient environment is too high, right? It's increasing core temperature. So the body's intelligence knows the parameters of what is healthy temperature, and so you begin to release moisture to reduce your temperature, right?
This is a very good understanding of a sweat, and just to let everybody know that sweat does not make you lose weight.
No, it's a temperature control mechanism, right?
Yeah, like, okay, I'm going really off topic
Please.
right now, but this is, I think, जब से मैं trainer बना हूँ, the amount of time that I've heard this, कि I have to sweat to lose weight, is like, I don't know, every now and then we used to listen to this, and abhi to it's gone down quite a bit. Nobody says this now, but still somewhere these concepts are there. Okay, they like to work out in a very warm temperature because they want to sweat, because they think sweat makes them lose weight.
So there is a psychological component that does obviously impact.
And
But no, sweat
no,
doesn't.
No, right now I'm talking about like doctors are doing these wrong practices, but I'll right now want to accept this, that even a lot of trainers are doing a lot of wrong practices, and every misconception, every myth that comes up, a lot of it comes from the trainers as well. So I'm been into a fitness industry, I'm sitting
For
down
sure.
and accept this, okay, this happens as well. And everybody have a learning process. The only problem comes in when your ego comes in between and
Yes.
you'll say like, okay, I'm never wrong.
Exactly.
We all are wrong at certain areas.
Absolutely.
And we learn and we understand and we adapt.
And I think the skill of a practitioner is being able to recognize the limitations, where their point of expertise ends, where they need help, and where they are sometimes even stumped, right?
Mhm.
Like, nobody's perfect. We're all human beings. We all have limited understandings of things according to our own experiences. And I think it's important to recognize that we all need collaborators in different areas, in different professional scopes, to help us fill those gaps. Because at the end of the day, healthcare and fitness and all of this is designed to improve people's lives, right?
Yeah.
It's meant to help you get better. You go to the doctor when you feel unwell because you want to be well. You go to a trainer to exercise because you don't like your body composition or you're struggling with functionality. So the same way that if a disc keeps blowing out, for example, in a person's body, and a fitness trainer is not looking at that chemistry, that trainer should be able to then refer that person to a medical doctor and say, hey, get your blood test done, and let's find out why these ligaments are so weak. Let's find out why you keep straining these muscles, right? Because the body is a complex system that we have a very limited understanding of, even today. What's that thing of 2% of your brain is all that we use, right? So what's going on with the other 98%? No one knows. And cutting edge research is kind of on that now, where we're beginning to discover the impacts of mindfulness and thoughts and your mindset and all of this stuff. But there are structural and physiological limitations that, yes, absolutely, need to be acknowledged, but then don't need to be given as an excuse for not doing something, right? There's always a way around, as long as you have the will to find it. So coming back to your original thing about squats, if a person is unable to do a squat, instead of saying don't do it, the attitude should be more aligned with let's figure out how we can do it, right? Maybe it's an assisted squat, maybe it's a Smith machine squat, maybe it's a front squat, a back squat, a hack squat, right? But a squat is a functional movement that everyone should do.
Maybe at the basic one, chair squat, like for a lot
Right.
of older people.
Exactly.
Like chair squat is like one of the most easiest thing. Where
Totally.
even chair squat you can do it assisted as well.
Exactly.
But just don't tell them not to do anything. Yeah, I understand the risk factor, because
Yeah.
if you do it stupidly, you will harm yourself.
For sure.
So injuries will come if you don't understand the mechanics of it. But at the same time, telling somebody not to do it have equal disadvantages.
For sure. And this is kind of where the mixed messaging comes in, because oftentimes I will get people in the office that will have three different opinions about what's going on in their body from three completely distinct professionals. And the confusion that it leaves a person in, right? Doctor said, don't do it. Trainer said, push through it. Physiotherapist said, I'll release this tension point and then you can do it. And at the end of the day, none of the approaches are working because there's no cohesive one-track approach to it, right? And I think, again, it speaks to limitations of knowledge and limitations of mindset, right? A doctor has a particular set of tools. Those tools tend to be pharmaceutically orientated, right? You have a series of symptoms. You match the symptoms to whatever presentation you see in clinic, and then certain medications are prescribed. Outside of that, medical doctors don't really have any other expertise. If you ask them to perform physical rehabilitation, they won't have the knowledge of range of motion, degrees of motion, muscle sort of activation, and all the sequences that come in with those compound movements, with those functional movements. So they should be referring you to a physio. But then you get to the physio, and the physio wants to do diagnostics, which is the job of the doctor. So isko bulate hain changing lanes, right? When you pick a professional track, what you're basically saying is, I choose this lane, and this lane is what speaks to me the most, right? हम जब एक दूसरे के lanes के अंदर shift हो रहे होते हैं, is where the confusion comes in for the person who's experiencing it. Now, as an example, we're sitting here in this podcast studio, right? I don't understand sound engineering, right? I don't understand microphone positioning. I don't understand camera angles or lights or anything of that sort. That is the expertise of the gentleman whose studio we're in, right? I'm talking to you about muscles and fitness. I have an understanding of muscle anatomy. I understand what neurological components supply what muscles. But if you tell me which muscle takes the greatest load in a squat, maybe if I'm compensating it's one muscle, maybe if I'm not compensating it's another muscle, that's your expertise. You'll share that with me, right? The same way if a person is being unable to activate a particular muscle in your gym, say that the glutes are not activating properly, you'll come to me and say this person cannot contract their glutes as effectively as they can contract their hamstrings, right? Then we look into the neurological pathway cause. Is that muscle receiving its proper communication from its command center, from its circuit breaker, which is in your spine, in your nervous system? Does that make sense? So we come together with all these different avenues and all these different approaches. And at the end, there should be collaborative meetings on a weekly basis for doctors in their clinics where they're discussing outcomes of patients amongst other professional specialties: nutrition, psychology, psychiatry, personal training, physiotherapy, chiropractic, right? And I'm sure if you go deeper, there'll be much, much more to come up, right? Magnetic healing, functional medicine, tapping, all kinds of things, acupuncture, hijama, all of these modalities have value when correctly applied within their own lane. So I think the message from that is just stay in your lane, right?
So do you think this is happening around us? Because I don't know what is happening internationally, but I just know what is happening around us. So you've been practicing here for almost 2 years now?
Almost 3.
Almost 3 years right now?
Yes.
And do you, and I know when you came to Muscle Matters and you wanted to do a collab, and we did a collab, and you were meeting all the other trainers and gyms as well. What kind of mindset did you find from the other gyms or trainers or maybe physiotherapists?
So I think the first thing that I was looking for was a curious mindset, right? Curiosity is a core competency of life. And so when you're curious about something, it leads you to investigate deeper. I think when we met yourself and Amna, when I met you guys for the first time to discuss the idea of collaborating, you had a curiosity about chiropractic beyond just the crack, right? I didn't experience a lot of that curiosity or interest beyond it. It was more कि उसका अगर कुछ गर्दन में फंसा हुआ हो तो आप कड़ाक निकाल के उसको वापस भिजवा देंगे, right? And that sort of showed that having, understanding that there's no baseline knowledge, that's fine. It's a new profession. It didn't exist in Pakistan to this level of clarity before. But they didn't even show an interest in wanting to learn about it, right? So I think mindset does trump a lot of things. Your body can be A, B, or C, but if your mindset is that of constant improvement, you can be the one to take your body from A, B to C. Does that make sense? Versus accepting I am B and I will never be anything more than B. Does that make sense?
I understand that. So coming back to neuroplasticity, one thing, does neuroplasticity happen because of age or it because of lack of activity? Because I'm asking you this question because there are a lot of studies that says like strength and muscle you can build at any age.
Yes, absolutely.
Yeah? So I think it's not just muscle and strength, it has something to do with the nervous system as well. So in your experience, in your education, one thing, is it being taught on them when you are doing your chiropractic degree? And or is it something that is the new research that says otherwise?
So we studied 5 years of neurology through the 5-year doctorate. Neurology was a component of every year. Different levels of neurology, different depths of neurology definitely did come up. I mean, the concept of neuroplasticity is that you can learn anything at any time. It takes longer when you're older because the existing neurological connections are so strong that sometimes pathways around them or through them can be a bit harder to find. So it's that idea of teaching an old dog new tricks. It is possible, but it takes longer when you're older. When you're younger, it can be a faster process. The body is generally more optimized and more efficient the younger that you are.
Okay, now I'm a little curious right now.
Please.
So you're talking about unlearning and relearning patterns of
Yes.
your body, right?
Yes.
But if you see the older individual,
Yes.
they don't so the pattern they had when they were younger, they don't have a same pattern right now, because all the functionality are going down right now.
That is a maladaptation. That is a negative
This
adaptation.
is where I'm coming, because right now unlearning, if you only do unlearning if you have learned something, but if you're losing everything, now there's no unlearning. Now you have to learn all those things that you have learned in the childhood, right? It's a recovery thing. So where I'm going with this, right? I want to know if the 70 years old person who was like, okay, I used to be a very sporty person, now I cannot sit on the floor anymore.
So let's start and ask why, right? What was
Yeah,
the why
and
is
I
the
have
biggest
done that.
question,
I have
right?
done that. I have done
What
that.
happened? Was there an incident where you got scared?
I'll tell you what happens, because this is now I'm coming from a lot of because I've done a lot of consultations in my whole career, and everything comes down to a point where they had some injury in their life in their 30s or 40s, and after that they stop doing certain things, or if they are too busy in their career, they stop playing, they stop exercising, they stop everything, and now they came to a point where they can't function the way they used to. Now this is not something that new they have to learn, but they have learned this when they were child, when they were kids, when they were in teenage. Now they just have to regain those functionality.
Right.
Now is there a different protocol? One thing between unlearning and learning, and one thing is to just recover from what you have learned in the past.
So I think everybody's fitness journey, everybody's history, everybody's body story, let's say, is a timeline. You start your life at a certain point, which is birth. You learn to crawl, you learn to walk, you get interested in different activities. For some people, it's cardio sport. For some people, it's weightlifting. And your body starts to store the patterns of your life story. Now, let's say in this example of a 70-year-old who suffered an injury in their 40s. What was the injury? What was the consequence the injury had on their lifestyle?
Let's just give an example. A knee injury. Now, then after that, she stopped using knee joint at that range of motion.
So the first thing to realize with that is that the knee probably wasn't comfortable, right?
Yeah.
Now, the knee, if we trace it back into the nervous system, receives a lot of its supply from the lumbar spine, from the low back. Now, if the person was female and they had a pregnancy around the same time, for example, everybody knows that your body changes a lot when you get pregnant. The pelvis expands and contracts twice, let's say. It expands once to accommodate the baby and then contracts down to come back to normal. And the shifting of those structures can change the way that your spinal segments are aligned. If those alignments did not happen properly because the functionality of the person postpartum, right, for example, wasn't focused on flexibility and strength training, those structures may have come back together in an incorrect way or in a slightly altered way. That then would have had a further consequence on the knee, tight hamstring, tight quad, pain in the calf, things like that, right? So when we look at something like a knee injury, it's important to look at the injury itself, but then also look at the other factors of your lifestyle that would have had an indirect consequence on the knee. Somebody who sits and works at a desk, right, is not going to use their leg muscles as much as somebody like you or me who work on our feet, right? We're standing all day, walking around all day. So the injury is what we call the inception point. That is the beginning at which the person lost confidence in their body because their body failed. An injury happened, they got hurt, and they were in pain. Coming back from that injury is just as important as the injury itself, because if that injury wasn't properly rehabilitated or assessed or even diagnosed properly, right, that person wouldn't have taken those immediate measures, not to fix the joint, but to restore their confidence in the body. This is the thing I see the most often in practice when people come from a place of chronic injury, is they lose the faith in their bodies. They think fail ho gaya.
I haven't seen people or any experts going into that kind of depth.
No, it's not a common thing in Pakistan.
And I think not just, let's just forget about professional. I'm talking about me as an individual who's, let's just say, not even in industry, and not in a fitness industry, not in a medical industry. being just a person who wants to live healthy has to know all those things. I
Yes,
think,
absolutely.
and these kind of understanding is important because, for example, I have a knee pain. Now I don't know what to do about it. The only thing I know is just don't use it. That's the only thing, and
Right.
the problem is it's not getting better.
So what you're talking about now is education, right?
Yeah.
The Pakistani mindset that I've encountered majority of is a very reactive mindset towards health.
Mhm.
Everything feels good, don't bother. When things start to not feel good, take action, right? The way I was trained and the way that I was brought up was a little bit more around a holistic perspective of preventative wellness versus reactionary sickness management, right? So if your body's feeling good, find out how to make it feel better, right? Or understand why it's feeling good. You slept well, you ate well, you have positive relationships in your life, you have a good self-esteem, you have a good mindset, your life is fulfilling, right? Versus everything in Pakistan is a drip, or it's an antibiotic, or it's a shot, or it's a... This is our national mindset towards healthcare, because our education is lacking to an extent where if you're talking about a 47% illiteracy rate, how are you going to educate people about health science when they can't even write their own names? Does that make sense? We don't
It
hone the
does. It
minds
does.
well enough to actually have this come up from our grassroots population to create then these professionals that we're training locally.
Do you think it's different in Western countries?
I think exposure is a lot greater in
Mhm.
Western countries. I think there's a lot more public service announcements, public health campaigns. You see them on bus stops, you see them on billboards, whether it's vaccination, whether it's diet, whether it's nutrition, whether it's smoking. There's a lot of health awareness abroad.
Mhm.
Also, you have to remember abroad, our lifestyles are a lot more active, right? You walk to the groceries, you walk up the stairs. If you give somebody a chair in Pakistan, they'll fight to see who can sit in it, right? Nobody's wanting to stand for long periods because they don't understand the benefits it has. Does that make sense?
Yeah.
So there is an element of education limitation. There is an element also of how we manage our health. I think the biggest one, though, that we face is regulation of our professional industries. You see, abroad, you have standards that each, for example, chiropractors have to register with an association. Your association has governing principles of practice. You can't really go off script if you want to keep your association membership and therefore your right to work. In Pakistan, we don't have an association, right? There isn't a regulatory body that's keeping an eye on what I'm up to, what you're up to, what the next chiropractor or physio is up to. We have the PMDC, but the PMDC only regulates those who prescribe medication. So anybody who's not in a medication prescription field is not going to have anything to do with PMDC. So they can say whatever they want, they can do whatever they want, they can write whatever they want, and there is no accountability for it. So you have, how do you create standards when there's no accountability? Does that make sense?
Yeah.
So it's a little bit of a Wild West, let's say, where people who are internationally exposed will bring back knowledge, will bring back experience to those that aren't. And then there are a lot of people in the country who are content with the way things are because they make it work. It's that concept of jugaad, if that makes sense, right? But what you're talking about is changing people's approach to health by not just focusing on injury and its management, but prevention of injury, right? Sustainability of activity. In my experience in the office, a lot of people who are 60 and 70 that will come in, will struggle to want to go back to exercise. Itni mehnat ko kisko karna hai, right? Because they don't understand the benefits it will have long term. And so what you were talking about with, don't sit on the floor, if you're told that 30 years ago and you don't use those muscles to sit, you rust, what is it? You rest, you rust. If what use it or lose it. The body is intelligent. It intelligently allocates resources to what you use the most. If something is not used, the intelligence of your body will reallocate, reabsorb muscle atrophy, will reabsorb those resources and allocate them somewhere else. Now, a lot of the times with weight, for example, what is fat? It is a body's storage supply of energy. You are consuming more calories, more energy than you are expending. One of the most basic ways of fat loss, neurologically or physiologically, is deficit, right? Create more activity and less intake. Does that make sense?
It of course
But
it makes sense.
we'll have
But
so many diet forms. Take this pill, drink this herb, sweat
yeah,
this out.
the problem is
Starve yourself.
the problem is like you explain it in a lot very simplest way of calorie deficit. You go to a lot of doctors, they're like, no, insulin is a problem, no, cortisol is a problem, you're eating carbs at this time, that's a problem. All these kind of variables that is coming in. And at times I have sit with the doctors and try to explain them this energy system balance. I have to explain them the law of thermodynamics, that how it is functioning, and this is the only way you lose or gain weight. But it is very difficult for them to understand. And one of the reason is there are a lot of noises out there right now. Comparatively, if you see 20 years ago, there wasn't a lot of noises, right? But right now, there are a lot of noises right now, where everybody is making content to sell what they want to sell, or in most cases, they sell what people wants to buy. There's a difference there. I believe in somewhere people know what is right, but they do not want to tell you what is right. They want to tell you what you want to listen. That's also one of the things, right? So I think in a practicing, when, yeah, all the practices aside, but when it comes to taking the responsibility, that's also one of the important factor with whatever you are doing.
100%, yeah. As a professional, you must always take responsibility for your practice and also take responsibility for your limitations. That's a big one, right?
Yeah, that's one of the uh, very famous, I think he is also a chiropractor.
Who's that?
I don't know, I should take a name or not. He's not from Pakistan. He's Dr. Eric Berg, and he has been promoting ketogenic diet for almost a decade right now.
Right,
He have his own certificate as well,
right.
and he's selling this weight loss magic, and he makes content about how to gain muscle. I have never seen him having a muscle, and he's talking about everything about health, and he have millions of followers. And a lot of time I see the information that he's giving is so misleading, and I was like, where is the ethical boundaries that we have?
Yeah, that's a delicate one. Ethics and professional integrity is not something that you can teach somebody. You can give the person the most up-to-date research. You can educate a person to the hilt, PhD, whatever you want. But how that person applies that knowledge and uses it in their practical day-to-day, that comes down to obviously each person's personality. I mean, if you gaze abroad in most sort of areas of professional careers, there is a lot of diversity, let's say. And no two chiropractors are the same way that no two personal trainers are the same. Maybe you believe more in isometrics, maybe he believes more in compound movements. Maybe I believe more in holistic adjusting, less is more. Maybe somebody else says crack everything until no more noise comes out. And, so every approach is different, every person is different. I think the key is to find your tribe. Find the people, the professionals around you to make a community of, like a network. I mean, I've benefited a huge amount from this in my practice in Pakistan. Pervez, you were actually my first collaborator in the city. And from that, I've grown into quite a diverse sort of, let's say, book where whatever a person needs in the office, if it's not in my scope of practice or I feel that I can't help them with it, I have professionals that I keep up to date with regularly that I can send them to. And that referral network, it's a trust mechanism, right? If someone that they trust is recommending something else, then there is an automatic trust given to that, right? So I think the important thing here is coming back to that idea of collaboration. No man is an island. No business is alone. Any business that you look at does deals with other businesses, right? Whether it's for supplies, whether it's for export, whether it's for import, whether it's for maintenance. We've lost the value of collaboration because everyone's trying to be the best. Everyone's trying to be number one. And what you realize is that being alone actually is easier to knock a single person down than it is to break a whole team. So sure, you have your expertise, I have mine. Pulling those expertise together, the idea is to help the person that's come to us and said, hey, I'm struggling with my knee or my low back or my weight or my fitness. And getting them to a place of knowledge and education, I think, is more important than practice output. I think if I say what is more valuable in my office is the things that people learn versus what comes out of my hands, right? If a person understands that this movement is possible, adapted, right? They walk out with confidence, with excitement, with positivity. That for me is a far more valuable output than a really good crack that sounded great on Instagram, right?
Yeah. So let's come back to this nervous system again. So I want to speak a little bit more about the nervous system adaptation. So if we compare a newborn baby who's trying to stand and an older individual who's trying to regain the functionality they once had. Now, if you think about the adaptation for both individuals, what's the difference?
So I think a baby is actually more powerless. A baby's adaptation is much more dependent on what the parents decide to do or not do for the baby. So a lot of parents will have understood something called tummy time. So when babies are born, they're fully in flexion. They're all curled up like little donuts. The flexion tone of the body is extremely strong because that's how they grow in utero. The whole concept of standing, crawling, lifting up the head, what you're talking about with this is extension tone, the extensor muscles of the body, which usually lie on the back surface versus the flexor muscles, which are on the front surface. Now, if a parent doesn't give their child enough tummy time, they can inhibit the amount of extension tone that the body will develop because unko mauka hi nahi mil raha. Does that make sense? With an older person, they are actually in a much more empowered state because although the neurological functions are the same, you're bringing muscles online, you're using different components of neuroplasticity to re-engage those connections between brain to body, body to brain. A baby doesn't have so much independence, so much autonomy. I think it's harder for a baby because a baby is subject to the whims of its parents, whereas an older person can educate and get back faster.
But if we just think about the capability of your own body,
Yes.
so they both can gain those neurological pathway
Yes.
equally?
Yes.
Or because of age, you have lost that ability to gain that kind of adaptation?
Not at all. The adaptation can come in at any time. It is obviously has to be mindful. If an older person has secondary health concerns that are already present as a result of their life lived to date, those factors must be considered, because they will become concerns otherwise. Osteoporosis is one, right? Low vitamin complexes in the body. So if your vitamin D is low, you're more prone to getting a ligament injury than if your vitamin D is normal, right?
Yeah.
If you're not eating enough protein, your body will not have the precursor material to build enough muscle, right? Muscle is protein. You need amino acids and proteins to build muscles. So I think that with an older person, it becomes a little bit more, let's say, complex because each person is unique. But if the factors all line up and a person is educated enough to understand where they need to fill those gaps, the only difference is time. Every process takes time. So as long as you're willing to put in the time, you'll get your result.
Okay, you mentioned something really amazing when it comes to functionality and the curvature of your body for the kids and the development of for the kids. I've never heard this, by the way.
It's a hot topic in chiropractic these days.
Yeah, I've never heard this, that tummy time. I've never heard this term. When the baby is born,
Yes.
do you think these kind of parameters should inform to the parents that you have
very
to
much.
these kind
Yes,
of things, or are they this information delivered to them, or they're not?
In the olden days, I think your midwives and your doulas and your sort of village elders that had these knowledges passed down from person to person had this information. But I think in the modern world, we've actually medicalized a lot of the birth process. And as a result, a lot of that knowledge about how to care for your baby's functional development is not really given to parents as much as, you know, weight gain and so another example of this would be something called primitive reflexes. Babies are born with a certain number of reflexes that are inherently present for their survival. One of the most commonly known ones is what we call the palmar grasp reflex. So you put your finger into a baby's hand, the baby automatically closes the hand. That's a reflex. As a baby develops and grows, reflexes will start to express to a point of exiting the system. So, for example, if you place your finger into my hand, my reflex will not be to do this. My reflex will be to keep my hand open. And if I choose to close my hand, then it's a choice, not a neurological circuit that's just firing. Does that make sense?
Yeah.
So, yes, a huge element of this is education, again, that needs to go out to parents to make them understand how to observe the reflexes, because the reflexes mark a baby's development into adult life.
Okay, so what if
Yes.
a parent is not giving enough tummy time to a child? What happens after that?
So,
like, let's just say for 1 year, 2 years, they didn't do it. After that, they realize, okay, we have to do this. Do you think the development stage is going to be as fast as when it was as a kid?
Not at all. If you don't give your baby enough tummy time, the extension tone of the body doesn't activate properly. If the extension tone of the body doesn't activate properly, then, you know, crawling becomes difficult. Walking becomes difficult. You'll often see this with the parents that will say, my child had delayed crawling. My kid didn't walk on time. And when we say on time, what does that mean? That's the markers that we set for a human body development. So I think that it manifests as an output of altered function, let's say. It doesn't show so much in the actual day-to-day of the baby, but it's when the baby doesn't crawl when it's supposed to. It's when the baby walks funny when it starts walking. Does that make sense? Because the precursor material, the baseline muscles needed for those movements are not as developed as they should be.
Does it cause any long-term functionality problem because of you didn't do certain things as a child?
So I think this battle between flexion and extension tone in the body is something that we're seeing more of now with the reintroduction of technology into our lives. So in caveman days and in older days when we didn't have things to sort of look down at all the time, we were very much balanced in our tone. So either you were working in the fields or you were riding horses or you were walking around or you were carrying objects from A to B. So we're born in flexion, we develop extension. And I think you and I have talked about this in training sessions I've had, where flexion tone is always going to be stronger than extension tone, right? So why is that? Because flexion tone is your baseline tone. Now, extension tone is what creates the curvatures of your spine. The curvatures are important because they are shock absorbers for the body. If your low back is a straight line, when you run, the impact from the ground to your feet is going to hit that straight up, absolutely no absorption of force. That force will catch disc injury, muscle pull, pelvic imbalances, strain into the abdomen, things like that. But if the low back is a spring, because it's curved, right, that spring absorbs the force and distributes it through the body, mitigates the negative impact. Does that make sense?
Yeah.
So text neck is something that we're seeing a lot of in chiropractic, where cervical curvatures, neck curvatures, are not bending forward as they should. They're actually straightening out or, in fact, reversing. So a reverse curve not only complicates blood supply and esophageal linings and things for the brain, but it also creates postural issues. When you
I
brace for
actually
weight,
showed you one of my old
yes,
clients' report that she has
exactly.
the same problem.
Exactly. So when you brace to lift a weight, where are you bracing from? You brace at your neck and shoulders, right? If your neck curvature is not aligned properly, when you brace, you can actually damage or injure a disc if your curvature is not properly corrected.
But did you see, compared to if you see 10 years ago and now, that things have changed right now in people posture because of the lot of mobile use?
I think, yeah, definitely. I wasn't in practice 10 years ago. I wasn't a chiropractor, or maybe I was in school 10 years ago. But from what I've seen, just from textbooks and from the studies that we were taught at college, introduction of technology to younger and younger populations is now becoming more common. So I didn't grow up with technology. I grew up playing in the garden and maybe watching a little bit of TV, but mainly with an active childhood. If I look at kids 2, 3, 4 years old, at restaurants or out and about, they're all glued to a screen. They're all looking down. They're all kind of focused on computers or on handheld video games, or they're no longer looking up at the sky, wondering what the moon looks like, or catching a ball.
Yeah, but let's just say the realistic approach towards this is like you cannot stop using mobile phone right now. We are
No,
not living in this day and age.
no.
What do we do then?
I think mitigating it. So, as much as you're leaning into the leaning forward, you must also compensate then with the lean back. So, neck stretches.
This is where I say like exercising is not the luxury anymore. It's a
No,
necessity.
it's a necessity.
It's a necessity
It
even
is.
for the kids. Like if you want to develop your kids in a healthy individual, forget about everything else. Just even they are nutritionally they are not eating right things.
No.
Just get them to the gym.
Yeah.
Make them work out. Make them do strength training, because the kind of adaptation strength training does to your body, regardless of how you look. I'm not even talking about the aesthetic look. I'm just
Right.
talking about the functional anatomy. Uh, the kind of service strength training do to your body, like you cannot get it from anywhere else.
I think it's important, again, though, to come back to that concept of everything in its right time, because people's bodies develop in different ways, right? So your brain doesn't stop developing till you're 24 years old,
Okay.
right? Your body stops developing by about 2021. Now, if you've got a kid whose growth plates, what are growth plates? It's where the bone grows from, right? If the growth plates are still active and soft, and you start putting compression force into those growth plates, you will arrest the development of the bones.
Oh, by the way, there's a research on it that if you put enough stress on the bone when the growth plates are active,
Yes.
your growth development will become better.
Depends on the kind of stress.
Yeah. So
Diverse
strength
stress.
training has a benefit.
Yes.
More than strengthening the contact sports like
Exactly.
kickboxing
I was
and
just going to
stuff,
say that. Yeah.
this is for more dangerous for kids than strength training.
Yes.
When they're in developmental stage.
Yes.
Even the contact sports like recreational sports like football, this is more dangerous than strength training when they're in a developmental stage, because your height do not stop because of the strength training. Because if you're putting the pressure now, okay, come back to like technical aspect has to be there. You cannot lift stupidly and expect things to work.
Right.
For sure.
100%.
But if you understand the protocol of lifting, if you understand the protocol of strength training, if you
Exactly.
understand the concept of recovery, if you're doing strength training the right way, you will grow better.
I agree with that. But I think, again, the right way is something that is not standardized.
Yeah.
There is no one unified understanding of what is the right way, right?
No, I'm just
So,
talking about the technicality of one individual exercises. Like, for
yes,
example, like if I have to teach you squats, so there is a yes, there's a little bit of anatomical changes that I'm gonna make for individual to individual
yes,
based on their limb length.
yes,
But at the same time, the baseline understanding of squats is not gonna change,
no.
right?
It's a functional movement.
Yeah, the baseline of any exercise is not gonna change.
Yeah.
A little bit of variation only comes because of your own length of your bones.
Yes.
Yeah, that's the only difference. But I think whoever comes to me, I was like, spend some time, initial time, learning about the exercise.
Yes.
Do not rush through the process. But I think for kids at any age, if they're going into a training, first thing, keep in mind, first thing, always learn the protocol, learn the understanding, have the understanding, then push it through. Growth plate is not that fragile when it comes to strength training, if you compare to any other sport. But if it is applied correctly, I think it's going to benefit you and not going to harm you.
No, I agree with that. I think, again, but the correct application is what we're
Yeah.
talking about, right? So somebody listening to this might turn around and say, oh, well, they've said now that strength training at any age is possible, so let's go for it. But it's conditional. You must
It is.
approach and apply correctly, factoring in an active growth plate versus an inactive growth plate, osteoporosis versus healthy bone, vitamin D deficiency versus vitamin D sufficiency, right? Every single person's body is unique and has a unique combination of limitations and areas where you are able to push, right? So somebody that has a long history of working out will build muscle much faster than someone who's just beginning, right? So you set that template in your body, that muscle memory, right? The body remembers how to build up protein chains when it's done it before. Does that make sense? So coming back to a workout plan after a break, for example, you will see results faster than someone who's never worked out before in their life, who's just beginning.
There's a concept of newbie gains.
Or newbie gains.
Newbie gains.
Right.
So if you have never trained, you'll build muscle much faster for somebody who have been training for so long, never took a break, conditional, never took a break, and still training. So if
Right. So
I'm
the
trying to
break
build
is,
muscle,
yeah,
if I'm trying to build muscle, I have a harder time to build muscle compared to somebody who's just starting.
100%.
Yeah.
But if your body has the
Yeah, but
memory,
if I had a break,
yes,
if I had a break and I'm coming back to the training, so I have a muscle memory, so I'm gonna build muscle much faster.
exactly.
So there are a lot of
For
conditions
sure.
there. Yeah.
But that again applies to we were talking about neuroplasticity, right? The body remembers, the body
Yeah.
has memory, it stores energy, it stores memory. If the bicep has an imprint memory of X number of 100,000 protein chains present to form a 12-inch bicep, a 14-inch bicep, and that bicep becomes 8 inches, going back to 14, the body has that template already. It just has to dig it out of the archives, assign the resources, amino acids, proteins, etc., and then build, right? Which is then the rest in the recovery.
Yeah. Yeah.
But I think functional movement is always going to trump, we're talking about children's development, functional movements are always going to trump specific movements. You need a fully active body. Kids that focus too much in one sport or in one type of training or in one type of exercise are never going to be as healthy or as athletic as people who have a complementing series, let's say. So I'm not saying stick to just football or stick to just strength or stick to just swimming. Combine them. Do a combination with adequate recovery time.
Yeah. So I'm gonna give a little bit of detail of you just said. So in the whole world, strength training becomes a part of every sport.
Yes, exactly.
Yeah. Now there's a strength training and there is a sport specific exercises. They're two
Yes.
different things. Strength training, you work on every muscle, but sport specific exercise, you're using those muscle in the range of motion and plane of motion that your sport requires. Yeah. Now, if you only do sport specific exercises, that means you will eventually develop a lot of imbalances in your body.
Absolutely.
Yeah. But if you combine it with the right strength training approach, you can avoid a lot of injuries in the future.
Absolutely.
Yeah. So when you said that work on the whole body and not just specific areas, now even the people who are going to the gym, whether they want to build muscle and lose body fat, do not focus on specific areas to train. Always focus on how do you train every body part equally.
Exactly.
Yeah, this is where I think a mistake happens. Like, for example, somebody wants to lose weight and they're just too focused on doing crunches.
Yes.
This is going to cause some injuries in the future. Yeah. So for my understanding, again, if a kid wants to build a big bicep, do not just start curling every day. So there are a lot of parameters and understanding. Sometimes it happens like when we say something, we say it with a different perspective, but the person who's receiving the information takes in a different
For
perspective.
sure. Always.
This is why I'm going into a little bit of detail what
No,
you
it's
actually
good.
mean,
Yeah, it's important.
because I know sports पाकिस्तान में तो एक तो sports का बुरा हाल वैसे ही है, especially cricketers right now, but I don't see in Pakistan strength training is a part of sport.
Because I think that, again, we were talking about this a little earlier with regulation. I don't think strength training in Pakistan is taught properly, right? If you go to most of the grassroots gyms in Karachi,
They do not want to hire, let's just say organization level.
right?
Organization level पे who wants to hire a good coach?
Look, even if we go a little further back from organization level, right, you have to look at the pool that you're recruiting from. You build an organization. You're one person. You've got your certifications. You've got your knowledge clear. You build a business. You build a practice. You build a gym. You build whatever, right? When you've got to a point where you're ready to expand or to grow, you start to look at your local workforce. What is available for me to bring into my office and apply as another resource in my business? So, on an organization level, yes, nobody wants to hire, but I can probably say it's because what's available to hire is of a very uneducated quality. We don't have a local certification standard, let's say, for trainers. There is no minimum application requirement to work in a gym. And this is kind of where I was going with going to any of these neighborhood gyms in any of these markets where a lot of these young guys started, right? How do they learn? Where do they learn?
Even because I worked in other countries.
Yes.
The regulation there is just a business.
It gives some implication
Because
of standard, though, right?
because I have seen those things. This is why I'm telling you this, that the regulatory body is just a business. It doesn't. Nobody gives a shit about the quality of the trainer.
And that's the
Nobody.
problem, right?
Nobody. Not in Pakistan, not internationally, nobody. Uh, because I have also seen the standard of education as well that is provided in those certification. I think that's lacking as well.
Yeah.
It is getting better. So I'm going to give credit to all those people who are doing something in the education sector when it
Exactly.
comes to fitness.
Yeah.
But still, we have a long way to go.
We do, yeah.
And one of the problem is like, if you see 10 years, 15 years ago, the certification is not created by the people who have been into the gym.
Yes.
They are created by people who are into a medical field somewhere. Not the people who have been to the gym, not the people who have worked with the athletes, not with the people who is like training
The ground
real
level
individual,
professional, basically, who
like
has
let
that
the thing
experience. Yeah.
come to the playground first,
Yeah.
see what is happening there,
Yeah.
right? Then you understand what is necessary to talk.
Yeah.
But what it is there, physiology, very important to understand. Not gonna deny that. Anatomy, very important to understand. But the thing is, there is something called practical application of everything.
Absolutely.
And I don't see that has been taught in any of the certifications.
Yeah.
Now the regulatory body, even you did the certificate. I when I went there, I completed my certification. I got myself registered. I have a license. Then I got the job, and then when I got to the job, then I found out nobody certified there. And what they are doing is like they first hire the trainers, then they get them certified, and then they get them registered.
Yeah.
So the process was all reversed. I did it with the right process, but still, I didn't see the quality there.
Yeah, it speaks to the professionalization of the industry. I think that, health and fitness has been a bit of a sundry industry, what you were saying, a luxury industry until very recently. But, the way our modern lifestyles go now, with everyone sitting a lot more than they should be and, for phone and technology usage, people need to start taking this kind of stuff more seriously because your trainer does have the power to injure you. He also has the power to help you achieve your highest potential. It depends on each individual trainer, right? So absolutely, you can teach everyone the muscles, you can teach everyone what they're called and where they go. Yeah. But if you understand what is more strong in its insertion or origin, what is more involved in this particular type of compound movement, what muscles kick in at what point, right? The reason that you can lift up to this point is because this big muscle is working, but that last little bit at the end is actually a very small muscle that you've never heard of, right? The trainers don't have the practical application of knowledge. Physiotherapists, in a way, might, because they do study active ranges of motion, passive ranges of motion, and mechanics. What we're talking about here is biomechanics, right? They have the mechanic training, but again, the application of that training is then up to each professional to interpret in their own way. Does that make sense?
Yeah.
So that means if you're wanting to train just that little muscle, maybe that physio is encouraging people to work on just those 3 or 4 degrees of movement, whereas somebody with a bit more of a global approach is going to say, do the whole functional chain, because you can't isolate just that guy and expect him to not get injured or to not hold. Does that make sense? It's too much responsibility for that little guy. He's part of a bigger group. Does that make sense?
Yeah, but who's going to invest in that bigger group? That's also the thing, right? So if you're talking about like any sports organization or anything, I don't see they're going to invest in those things. Like I I know they have a resources. We all know that they have a resources, but do they have a understanding that what they require?
Yeah.
Even I reached out to, just out of curiosity, I reached out to one of the franchises and I was like, I asked like, what is the criteria? How they're doing? They're like, they don't give a shit about fitness. That was just their criteria, and I was like, okay, hands off.
Yeah, yeah.
I don't want to go there.
Thank you for your input.
Okay, so it was really nice talking to you. I think I'm gonna come to you very soon for my own chiropractic
Please
care.
welcome anytime.
I've been thinking for quite some time. Thank you so much for all the insights of chiropractic and all the things that we have discussed. So hopefully we'll do another podcast with some different topics, and
100%. Yeah.
and it was really nice talking to you.
Yeah. Thanks, Pervez. Thanks for having me on the
Thank you.
podcast. It was great to chat.